Welcome back. Well, global dementia cases could triple by 2050 if nothing is done to mitigate risk factors. That is according to a new study, which further says the highest growth will be in the Middle East, North and East Africa. So for more on this, we're joined now by Borochowitz from Dementia South Africa. Karen, thank you so much for your time this morning. How much are we yet to know about dementia, and do we talk about it enough, especially in South Africa?
Well, Faith, good morning, and thank you for having us, and certainly to your viewers too. The real challenges is that, we have the figures that say that it's going to be greatest in this area, that area. That's the epidemiological study. But the real thing is to remember always that this affects people. This affects the lives of people, carers. You have to care for family members, people in communities, etc. So it is a completely, if we look at it in terms of actually affecting the numbers of people that we're going to be coming into contact with, it really just changes the whole landscape.
I mean, we're talking about how there's a huge change of landscape, but also on the other side of it, it's around the support that the family would need in that time so that they know exactly what they're dealing with and that there's no excess fear that is associated with it. Do we have those kinds of support structures in South Africa, including external support structures?
Well, the very, very first thing is firstly to get a diagnosis. And that, I think, in South Africa, that is very, very, very difficult. There's a number of factors for that. Firstly, our public healthcare sector is not well enough developed. Dementia is not a priority, a healthcare priority in South Africa at all. And, when it comes to, psychiatric units, spotting the signs, the warning signs of dementia, etc., that doesn't exist. So once a diagnosis, is made, it's only about 5 or maybe even 6 or 7 years on from when the person was first onset of the disease. So the support structure is actually vital. That really is. There was a study produced in Australia a number of years ago that said for every one person with dementia, there are 5 to 7 people that are affected in the care of that person. So, we rely very heavily on, media, our website, for instance, to get, awareness out there and education out there. And also, that at the end of the day, it's not just the spouse that cares for the person with dementia, it's the entire family. So it's getting the whole family on board to ensure that the support is there for the person living with dementia.
You're speaking here about how we do not necessarily go into diagnosis quite clearly, never mind the support structure that goes into it. One wonders about those that are within disadvantaged communities, those that are in rural communities, Karen. What impact is it having on them? Are they getting even any form of even diagnosis, just from a simple case of diagnosis? And how many people in the rural areas or in the disadvantaged areas are going undiagnosed, untreated and uncared for?
Well, that's really a very, very big point of concern. Dementia SA was involved in an epidemiological study up in Madwaleni in the Eastern Cape. And we were absolutely appalled at the availability, firstly, of medical solutions, public health, facilities that were able to do some kind of diagnosis. And then secondly, what the local perceptions were around the disease itself. Because it's really sort of a silent disability and it affects the person in more ways than one, in terms of their behavior, in terms of their ability to cope. Many people thought that they were bewitched or that it was umtagati that had got hold of them. So it's about getting, traditional healers on board to start having these discussions that just as much as it is diabetes and high blood pressure, etc., so is dementia, very, very much part of the discussion that needs to be had to keep these very, very vulnerable people very safe.
Sure. Yeah, as you're speaking about it, Karen, I'm grateful for platforms like this that allows us to actually talk about it and spread the knowledge. We have to leave it there for this morning, unfortunately, but thank you very much for that one, Karen Borochowitz there, just giving us the latest in terms of what does it look like for persons living with dementia in South Africa.